next speaker is Dr. Laila Souda. Dr. Laila Souda is a German board-certified specialist in obstetrics and gynecology. She received her Doctors of Medicine from Berlin University and her postgraduate in Hanover University. She has spent 20 years in Germany and 19 years in Dubai and continues to strive for excellence in her field. She's the medical director, CEO, and founder of Dr. Laila Souda's clinic, which is a very well-known clinic in Dubai. Welcome, Dr. Laila.
Thank you so much for the invitation for the second time in a row, second year. Thank you for the introduction. I have no conflict of interest. I'm going to talk to you about acne in functional medicine. The abstract or the learn in this slide is going to be presentation how acne is, the pathogenesis is multifactorial. That's why the treatment should be done holistically. I'm going to show you how you can receive long-term results which will not affect only your skin, but it will affect your entire health. Medication and creams alone, unfortunately, are not enough. They are important, but not enough. Supplementation, lifestyle, clean eating, exercise is very important. What is holistic medicine? Holistic medicine is actually prescribed the way you treat a patient. A holistic doctor will not look and treat the symptoms, he will treat the cause of the symptoms before he recommends you any medication. It is very important to know and ask the question, why? Today the discussion is going to be, most of you know this more than me, how to diagnose the acne, how conventional medicine treat acne. Looking for the root cause is going to be the key. I'm going to speak about how functional medicine treat acne. I'm going to speak about acne versus androgen, hormone, acne versus thyroid, acne versus insulin, acne versus food and sugar, acne versus gut. Some of the points Dr. Simpson has mentioned this because we are from the same school. What is acne? This you know more than me. It is actually a gland disease. Usually it starts in the puberty in a young age, and it can be in the face, neck, trunk, and arms. And as we said, the pathogenesis is multifactorial, is not one reason. It's a long-term disease. That's why the treatment should be long-term treatment. The hair follicles are closed, its dead skin is oily, they have blackhead, whitehead, pimples. I'm going to go through this very quickly. The diagnosis needs to be confirmed when you see blackhead and whitehead and commodin. The history is extremely important. When she gets the acne, it's related to the period, is related to food, is related to any trauma in her life. It started usually 20 to 30 years age, but the new research showing me even patients with 40 and 50, perimenopausal, postmenopausal patient is getting acne. So this is definition by book. The reality is different. Some of them start with the menstrual cycle. It's important to know. How many stages? Again, you know this more than me. It's mild, moderate, and severe. For me, it's extremely important to know with which stage I am dealing with to know that I need to go deeper in the system of the patient. This is the different stages. If a patient comes with mild acne and severe acne, different way of treatment. I am for a multidisciplinary treatment of acne. That means dermatologists, gynecologists, and aesthetic doctors hand in hand to get long-term results. Statistically, worldwide, I don't have UAE statistic, but in America, 60 million people are getting acne. 80% of them are women. According to 2016, 85% of these patients in any time of their age, they getting acne. Acne is harmful for our mental health patient. That means 69% feeling depressed, 46% feeling low self-esteem. My daughter refused to go to the school that time as she got acne. This is really important. Declining social activity, 30%, 40% even having suicidal thoughts. That's why acne treatment, multidisciplinary, is extremely important. Treatment as per conventional way, topical cream, antibiotic, we spoke about retinoid, contraceptive, anti-androgen, laser, light therapy, chemicals, stem cells, whatever we want. There is a lot of ways. But now I think it's the time to think out of the box. We need to, worldwide, there is a concern, and I'm going to show you the reference later, that antibiotic that the patient showing more overreaction and resistance. So that means maybe soon I cannot give antibiotic anymore, I need to look for an alternative. So how functional medicine, which is the school I am coming from, treating acne? Acne could be androgen hormone imbalance, could be insulin resistant, could be thyroid function, could be gut health, could be inflammation, could be food and lifestyle, stress, and genes. It could be all of them. So acne and hormones. I treat acne, I worked in Germany, I studied in Germany, so the first step for a patient who has acne is the gynecologist. So we treat them with hormones, we check their hormones, usually it's testosterone, free testosterone, SHBG, growth hormone, and insulin-like growth factor are involved. In my experience, most of the time, these hormones are normal. Do I have alternative way to lower hormones in case they are elevated? Yes, I do. Resveratrol is a natural polyphenol found in the grapes and fruit. Some of the speakers mentioned this before. It has a lot of study with PCOS done over 3 months. They give the patient over 3 months resveratrol and one study group. 23% of them reduction of acne, 22% reduction of hormones, which is DHEA, and reducing insulin sensitivity, reducing insulin concentration, and increasing the sensitivity. The difference, you know, right? Okay, what is other alternative is sopalmato. Sopalmato is actually an extract. It's from Native American, they were used it. It is rich on fatty acid, it's immune system booster, and it was used and still used now for treating of acne, which is based on hormone. I use it usually if I have elevated testosterone with the patient. Sopalmato has more than one effect. It can be used by estrogen-dominant patients, because estrogen-dominant patients, they build in their fat more testosterone from estrogen through the 5-alpha reductase. So it lowers the testosterone, but it doesn't affect the progesterone. So I will have more balance in the testosterone as well, estrogen, progesterone balancing as well. I use it, I have good results with it. Acne and thyroid. Thyroid is really a big issue because most of the endocrinologists, with all my respect, they check TSH, and if the TSH is normal, they tell the patient you have no issues. TSH alone is not enough. We need to go for the whole hormones. Total T3, free T3, total T4, free T4, antibodies, reverse T3, important. Very often I see normal TSH with the patient, but she has antibody elevated. This is the way we do it in the functional medicine. We try to optimize the numbers. We have to compare all the hormones and see if they are in the optimum level. Thyroid is not for reason in the central of our body. There is a study, I like this, 2012, done about patients who have acne and positive antibody. They did not find a big difference in the ultrasound, but they find that, I make it for you in red, that these patients with acne, they have elevated CRP and they have elevated thyroid antibody, though all the other hormones of the thyroid are normal. So look at the antibody, please. Thyroid function, it depends on a lot of things. It's not only I give the patient thyroid hormone and it's done. Thyroid needs hormone balance, need testosterone, progesterone, need vitamins, need vitamin D. The conversion T4 to T3 is extremely important. It needs iron, ferritin level of 130 so that the thyroid should function properly. Acne and insulin, my colleague spoke about what is insulin. Insulin is an inflammation hormone. I have high insulin, I am inflamed. Acne is an inflammation disease. So, insulin is very important. It is like the key and the lock. They go inside each other, and the insulin will bring the sugar down. In case I have overdose of sugar, that means I will become insulin resistant. What that mean? That means I need to produce more insulin to burn little bit of sugar. So my insulin in the level is always elevated, which cause me what? Craving, which cause me fat, which cause me inflammation, which could cause me acne. So insulin resistance is really a huge issue. And I go by the German Endocrinology Society. I put for you down all the references. The insulin has to be low fasting, go only 5 times the fasting level after I am eating 1 hour, and it has to go down, so it will not make me resistant. If it go up and go little bit down after 2 hours, I am mild insulin resistancy. If it go up, then I am a high insulin resistancy. It doesn't matter only the numbers. The direction up and down is extremely important to diagnose a patient with mild or severe or high insulin resistance. There is a lot of ways to treat insulin resistance with supplementation, with vitamins, with chromium, magnesium. I'm going to give you references for that. By the US National Library, it was a study done about cinnamon. They give cinnamon to the animal, they find they will have less insulin resistance. They make a study on human being. For 3 months, they give them 1 to 3 grams of cinnamon, and they find that the glucose lowered to 18 to 29%, and the insulin sensitivity getting better. Another study was done about magnesium. Magnesium giving to the patient, a study, it is low number of patients, but this study went for 6 months. These patients, by taking magnesium, it lowered their insulin in the body, and they will have better insulin sensitivity. So vitamin D, my colleague spoke about vitamin D. The problem is the optimization. Vitamin D, 30, 40 is not enough. 60 to 70, try to optimize your patient, to optimize your treatment for their skin. There is a very promising supplementation out there. It's called berberine. Berberine is also an alkaloid derivative. They did study how berberine can be lowering insulin. 2008, 36 patients was given 1,000 to 1,500 milligram. Very big, 44% lower resistance, 28% in few days, they have better insulin sensitivity. I use berberine in my clinic a lot. Another study performed in Iran find that supplementation of acne patient with berberine for a few weeks lead to bettering their acne 45%. I think it is worth to try it. So the incident again, okay. Very important also the insulin and growth factor. There is more he study about carbohydrate diet and insulin sensitivity and acne. Again, it's worth it to speak about metformin in the, reducing the insulin sensitivity and acne. Here you have more references. Now, the conclusion, we spoke about it. How I treat acne and inflammation. The root cause of inflammation is a lot. Look at the root cause and treat it. Now, I will go quickly. Acne and anemia is very much related. Genes. Genes is about detoxification. These genes, they can tell you if you can make methylation or not. Detoxification is the most important treatment in acne. Acne could be related to any other sickness like pregnancy or overdose on medication or even illegal medication as well. Thyroid, diet and acne. Acne and gut, my colleague spoke about it. Now I am going to go to how I treat acne in my clinic. We take a very big history. We take symptoms list, very long symptoms list, and we have 5 steps of blood investigation. Depending where I start with the blood investigation, what is this patient offering me on symptoms? So I have these 4 or 5 steps. I brought for you patients now, before and after picture. None of these patients almost have any hormonal issue. Most of them, she has high insulin resistance, pre-diabetes, hypothyroidism. Before and after, in 14 days, this patient has hypothyroidism. She was amenorrhea. Her hormones was not elevated. Testosterone even was normal. She had gut issue. She was not going to the bathroom for 2-3 weeks. This patient, again, most of these patients, if you look, she has candida in the gut. For example, what was more important? Androgen more in the higher normal level, but not that elevated. Insulin resistance, most of them have it. This patient, hypothyroidism, insulin resistance, she has an adrenal fatigue. Adrenal fatigue, that means all her hormones are down. Testosterone, DHEA, cortisol. This lady, this is the only lady I treated her with hormones because she was going about to get married in 1 month. She was in a hurry to get clear face. But now she is almost, she don't take hormones. We only fix her insulin and her ferritin and vitamin D. This lady is the same. Testosterone is normal. This lady is the same. Most of them, they have. This lady, she allowed me, she is a famous person out there in the social media, she allowed me to put her picture. This lady, she took every single antibiotic that you can imagine and medication. She was by dermatologist, aesthetic. Actually, aesthetic center sent her to me. We find out that she is high insulin resistance. We changed her lifestyle, we changed her diet, we put her on insulin sensitizer, and this was her before and after, and I see her since 2 years. She still even look. She lost weight, she looked gorgeous, her face is beautiful. This is the only patient that I put her on hormones, but always fixing the other things. The same. Thank you so much.